What if your heart gave out and no one was there? Not your spouse, not your kids, just you in the quiet of your home. It's a terrifying thought, but for many people, it's more than just a thought. It's reality. Most of us assume we'll have time or that someone will be nearby to help. But when it comes to a heart attack, the truth is simple. Those first few minutes decide everything. Here's the good news. Even if you live alone, even if no one's around, you can survive, as long as you act quickly and you know what to do. In this video, I'll walk you through 7 essential steps to take the moment your heart starts to send a warning. No medical training, no fancy equipment, just calm, clear actions you can take to stay alive. You'll learn how to spot the earliest signs, what to take right away, and how to keep your heart from working too hard until help gets to you. Now, I encourage you to stay with me until the end. Because the last few steps, they're the ones most people forget, and they could be the ones that save your life. Don't wait for a crisis to learn what your body's trying to say. Listen now, before it's too late. Let's get started. Number 1, recognizing the earliest warning signs. The very first step in surviving a heart attack alone is knowing what it actually feels like, not just in your chest, but throughout your whole body. A lot of people expect a dramatic, crushing pain, like in the movies. But in real life, heart attacks often start quietly. The early signs can be subtle and easy to brush off until it's too late. So here's what to watch for. A deep, heavy pressure or squeezing feeling right in the center of your chest. It might feel like something is sitting on you, or like your chest is slowly filling with cement. Sometimes it comes and goes, and that can fool you into thinking it's not serious. But if that feeling lasts more than a few minutes, or keeps coming back, don't ignore it. Other early signs? Shortness of breath, even if your chest doesn't hurt. You might feel winded, like you just walked up a hill, even while sitting still. Some people feel pain or tightness in the arm, shoulder, neck, or jaw. Others break into a cold sweat, feel dizzy, nauseous, or suddenly lightheaded. And for many older adults, especially women, it might feel more like pressure in the stomach or back, rather than in the chest at all. Let me give you an example. Walter, age 74, was sitting at his kitchen table one morning. He felt a strange tightness under his collarbone, kind of like heartburn. Then he noticed he couldn't take a full breath, and his hands started to sweat. He remembered hearing that not all heart attacks come with pain, so he didn't brush it off. He acted. And that decision, it may have saved his life. The truth is, your body whispers before it screams. And when it comes to heart attacks, those whispers, they're your only chance to act before the real damage begins. So the next time something feels off, especially if it's chest pressure, shortness of breath, or sudden fatigue, stop. Don't try to tough it out. Don't tell yourself it's just indigestion. Recognizing these early warning signs, that's your first shot at survival. Take them seriously, even if they seem small, because your life might depend on it. Number 2, calling emergency services immediately. The moment you even suspect a heart attack might be starting. Don't wait. Don't see if the symptoms go away. Call 911 right away. Don't try to drive yourself. Don't assume you're just being dramatic. Calling emergency services isn't just the fastest way to get help. It's the most effective thing you can do to stay alive. Because heart attacks don't wait, and you can't walk them off. Every single minute matters. The longer your heart is starved of oxygen, the greater the damage. But once you make that call, the clock starts working in your favor. The paramedics are already preparing as they drive to you. They're bringing equipment, medications, and the skills to keep you alive. If your symptoms get worse, and they often do, or if your heart stops before you reach the hospital, you won't be able to help yourself. That's why trying to drive is one of the most dangerous choices people make. You could pass out at the wheel. You could delay the very care you need. Let the professionals come to you. Let me share a story. Linda, age 78, was home alone when she felt a strange ache in her left shoulder. Then came the nausea, the cold sweat. Her first instinct was to call her son, but she remembered something a nurse once told her. If you're alone and you think it might be a heart attack, call 911 first. Talk to family later. So she did. By the time the ambulance arrived, her symptoms had worsened, but the team was ready. They stabilized her right there in her home. That one phone call saved her life. And remember, you don't have to be sure it's a heart attack to call. The dispatcher won't be upset if it turns out to be something else. In fact, they'd rather you call than miss your chance to survive. So please, keep your phone somewhere easy to reach, especially if you live alone. If you feel symptoms coming on and can't speak clearly, use the emergency call feature on your phone. Many phones now have a shortcut that works even when the screen is locked. Learn where it is. Practice using it. And if this video has been helpful so far, I'd love to hear from you. Comment the number 2 below so I know you're still with me. And if you haven't already, I recommend subscribing and turning on the bell. That way, you won't miss future videos that could help you or someone you love. Now, let's keep going. Number 3, chewing an aspirin, slowly and calmly. After you've called 911, there's one more action you can take, and it could make all the difference. It's simple, but powerful. Chew an aspirin. Don't swallow it whole. Chew it, and do it slowly, even if your hands are shaking. If you have access to a standard 325 milligram aspirin, and you're not allergic or on a medication that prevents you from taking it, this step could significantly improve your chances of surviving. That's because aspirin thins the blood. It helps slow or even stop the growth of a blood clot, and that clot is often what's blocking one of your coronary arteries, the very thing causing the heart attack. Chewing the tablet instead of swallowing it gets it into your bloodstream faster, and studies show those extra minutes, they can matter. Sometimes it's enough to start restoring blood flow, even before help arrives. Now, ideally, don't take aspirin on an empty stomach, unless you absolutely have to. But during a heart attack, the risk of a clot far outweighs that concern. Also, if all you have is a coated or delayed release aspirin, chew it anyway. You need it to start working as fast as possible. Let me tell you about Joe. He's 72, and one morning he felt a tightness creeping up from his chest toward his neck. He remembered he had aspirin in the kitchen, so he grabbed one, sat down, and chewed it while waiting for the paramedics. Later, his cardiologist told him that simple action, it may have reduced the damage to his heart. That little pill kept things from getting worse. If you live alone, make sure aspirin is easy to find. Keep some in your nightstand, your kitchen drawer, or even tucked inside your wallet. Make sure it's not expired, and let your loved ones know where you keep it, just in case. This may seem like a small step, but it's backed by science and trusted by emergency responders around the world. Chewing aspirin at the first sign of a heart attack, it's not just advice, it's a proven lifesaver. And in those critical first few minutes, it could mean the difference between walking out of the hospital or not making it there at all. Number 4, sitting or lying down to protect your heart. Once you've called for help and taken an aspirin, your next step is simple, but absolutely critical. Stop moving. Sit or lie down in the safest, most comfortable position you can. This is not the time to pace the room, gather your things, or unlock the door, unless it's absolutely necessary. Any physical effort right now adds strain, and your heart, it's already fighting to get the oxygen it needs. The best position? Sit upright with your back supported, feet flat on the ground, arms resting loosely at your sides. That posture helps your heart work less while you wait for the paramedics. Now, if you feel faint or lightheaded, lie on your side with your head slightly raised. Don't try to push through it. That power through the pain mindset, it may have helped you before, but not here. Right now, it's a risk you can't afford. Some people feel awkward just sitting there, calling for help, and then doing nothing. But here's the truth. Doing nothing is doing something. It gives your heart a chance to stabilize. It slows your breathing, and it conserves the oxygen your body so badly needs. Let me share Alice's story. She's 81, and one morning she felt pressure spreading across her chest. Her first instinct, tidy up the kitchen, pull herself together. But then she remembered what her doctor once said. If you think it's your heart, sit down. Everything else can wait. So she dropped into her favorite recliner and waited. That stillness likely kept her from slipping into cardiac arrest. So if you ever feel those warning signs, pressure in your chest, shortness of breath, lightheadedness, don't try to finish what you were doing. Stop. Right there. Move only as much as you need to find a safer spot. Then sit or lie still. Breathe slowly and let your body focus on just one job, surviving. One last tip here. If you're sitting on a chair without armrests, don't let yourself slump. Support your spine. Keep your airway open. The more relaxed and upright your posture, the less effort your heart has to make. And if you're still watching this video and finding these insights helpful, comment the number 4 below. It lets me know you're still here. And if you haven't subscribed yet, I'd recommend doing that now and turning on the bell. That way, you'll never miss a video that could protect you or someone you love. Now, let's move on. Number 5, unlocking your door for emergency responders. If you still have enough strength after calling for help and settling your body down, there's one more small but powerful thing you can do. Unlock your front door. It may not sound like much, but in a medical emergency, even a few seconds matter. And a locked door, that can slow everything down. Now, of course, paramedics are trained to break in if they need to, but forced entry takes time. It causes damage, and it can startle or even hurt someone who's already in distress. If you're near the door and feel steady enough, unlocking it ahead of time lets them walk right in and start treating you immediately. That small action, it could buy back several minutes. And for your heart, those minutes might be the difference between life and loss. If you live alone, especially in an apartment or gated community, now's the time to plan ahead. Is your door easy to open from the inside? Is your address clearly visible? Do you have a spare key and someone nearby who can get to it? These things may not seem urgent until suddenly they are. Let me tell you about Paul. He's 76 and lives alone in a small condo. When his symptoms started, he did 3 things right away. He called 911, he chewed an aspirin, and he unlocked the door. The paramedics told him later that one action shaved off 30 seconds. It kept them from having to break in. And Paul said, "I never would have thought of that. But maybe that's what saved me." Now, if getting to the door feels too risky, don't do it. Sit. Stay safe. Focus on breathing. But if you're close and feel steady enough to reach it safely, go ahead and unlock it. You might also think about getting a smart lock with remote access, or a lockbox for a spare key, something emergency responders can access quickly, especially if you live alone or have limited mobility. It's a small act of preparation, but it tells the people coming to help you, you're ready. You've done your part. Now it's their turn to do the rest. Number 6, using your phone speaker or medical ID features. When you're waiting alone during a heart attack, your phone becomes more than just a way to call for help. It becomes your lifeline. One of the smartest things you can do in that moment is switch your phone to speaker mode. It may sound simple, but it changes everything. Using speakerphone lets you talk to emergency responders hands-free. That way, you can focus on breathing and staying calm, without needing to grip your phone or hold it to your ear. Because when your body's in distress, even that small act, holding a phone to your head, can make it harder to breathe. Speakerphone reduces strain, and it lets the dispatcher hear you more clearly. Even more importantly, if you suddenly become too weak to speak, they can still hear you, your breathing, your movements, your tone. And that might help them understand what's happening, even if you can't say a word. Now, there's something else your phone can do. Every smartphone, whether iPhone or Android, now includes a medical ID feature. On an iPhone, it's accessible right from the lock screen. And on many Android phones, there's a similar option. This simple feature can hold vital medical info, like your age, medications, allergies, or any serious health conditions. If you're unconscious when paramedics arrive, this data helps them make fast, safe decisions. Let me tell you about Susan. She's 79, and she passed out just a few minutes before help arrived. But because she had her medical ID set up on her phone, paramedics saw right away that she was diabetic and allergic to penicillin. That information kept them from giving her something that could have made things worse. And they were even able to contact her daughter because her number was saved as an emergency contact. Setting this up takes less than 5 minutes. But it could make all the difference when you can't speak for yourself. Add your name, birth date, conditions, medications, allergies, and 2 emergency contacts. You don't have to be tech savvy. Just take a few minutes and make it part of your safety plan. So if you ever feel those first signs of a heart attack coming on, use speakerphone. Stay connected and let the voice on the other end walk you through the wait. Because if something happens before help arrives, Your phone might still speak for you when you no longer can. And if you're still watching this video and finding these insights helpful, comment the number 6 below so I know you're here. And if you haven't subscribed yet, I invite you to do that now and turn on the bell. That way, you'll never miss a video that could help you or someone you care about. Now, let's move on. Number 7, slowing your breath to steady your heart. In the middle of a heart attack, it's easy to feel like panic is taking over. Your chest feels tight, your thoughts race, and every second seems louder than the last. But even in that moment, you still have one tool left, your breath. And if you use it well, it can calm your nervous system just enough to give your heart a better chance at holding steady. Now, let's be clear. Controlled breathing won't stop a heart attack, but it can stop your body from spiraling into full-blown shock while help is on the way. Here's what happens. The more anxious you become, the faster your heart tends to beat. And that stress can push your heart into dangerous rhythms. But slowing your breath, even just a little, can gently bring that pace back down. You don't need a complicated technique. Just try this. Breathe in slowly through your nose for about 4 seconds. Hold that breath for a moment. Then exhale gently through your mouth for 6 seconds. And repeat. Focus on that one rhythm. Inhale, pause, exhale. It gives your body something to anchor to, something steady when everything else feels out of control. And it can help reduce the risk of stress-triggered arrhythmias, those dangerous irregular heartbeats. Let me share Frank's story. He's 83, and when the pain hit, he said it felt like he was drowning in fear. But he remembered a simple breathing exercise, one his doctor had taught him months earlier. So he focused on his breath. He kept his body still, and he let go of the panic. By the time the paramedics arrived, his heart was still unstable, but not in full arrest. "I just kept thinking," he said later. "Stay calm, stay alive." This kind of breathing is something you can practice anytime, while resting, while feeling anxious, even while watching TV. The more familiar it becomes, the more naturally your body will return to it when you need it most. Your breath won't fix a blocked artery, but it can buy you time. It can keep oxygen flowing, and it can help your heart hold on just long enough. And in those final moments before help arrives, sometimes that's the only edge you need. Stay still, stay calm, stay alive. Final thoughts. At the end of the day, surviving a heart attack alone isn't just about luck. It's about preparation, awareness, and calm, clear action. These 7 steps may seem simple on their own, but together they form a powerful chain, a chain that can truly save your life. Recognize the warning signs. Call for help right away. Chew an aspirin. If you can, sit or lie down to save your strength. Unlock the door if it's safe. Use your phone's emergency features wisely. And slow your breathing to keep your heart steady. Each step buys you a little more time. Each one gives you a little more control. And together, they send a powerful message. Even when you're alone, you are not powerless. A heart attack can feel like the most frightening kind of solitude. But these tools remind you, you are not helpless, not even for a moment. You now have knowledge, you have a plan, and you have the strength to act, even when it counts the most. So take a moment, ask yourself, what stood out the most to you today? Was there a step you hadn't thought about before? Or one that now feels even more important? Think about how you can apply these steps to your own life, and maybe share them with someone you care about. Because what you've learned here today, it might not just save your life, it could save theirs too. Thank you for spending this time with us. We'd love to hear from you. Leave a comment below and share one thing you learned and how you plan to use it. Your voice matters. And reading your comments, that's what encourages us to keep going. If this video helped you, even in a small way, please like, subscribe, and share it with someone you love. Your support helps us keep making content that informs and inspires. Thanks again for watching, and we look forward to seeing you in the next video.